program in 2019. So today I'm just going to go over a little bit about the different wives can be part of. And I think when going through this presentation, I kind of wanted to questions that I had when I first graduated. When I was applying for jobs, I kind of was trying to figure out what the words and what it meant when I was looking for different practice settings, like what would my the job going to entail at different practice settings. So that's where most of the how we'll kind of approach this presentation. So again, a little bit about me. I graduated from University of California, Riverside in 2012 with a bachelor's degree. I decided to do another bachelor's degree in nursing. And so I did that about a year and a half later. After I graduated nursing school, I wanted to really make sure that maternity care was what I wanted to be part of, and reproductive health. So I was a nurse for a couple of years before deciding I'm going to go back and obtain my midwifery degree. So I worked as a L&D nurse in Washington, D.C. and San Francisco. And then I came back to California because I am a Southern California native. And I finished my midwifery degree in 2019. Since then, I've been kind of all over the place. I've been working in Southern California. My first job was in private practice with a high-risk OB. Then from there, I went to a freestanding birth center. And now currently I am working in the hospital setting again. I'm at a hospital birth center, but I have a couple of clinics where I do gynecology, reproductive care, and prenatal care. So we can go on to the next slide. So I kind of, just like I had mentioned previously, kind of want to go over some of the terminology when it comes to like practice settings, because whenever we are looking at when we talk to individuals, like where do you practice, and especially also when looking at jobs, also looking at through the descriptions, it's kind of good to kind of figure out what the description is of the practice setting. So when it comes to terminology like ambulatory care, generally that means that in that practice setting that you will be in the clinic. So you'll either family planning clinic, prenatal, you'll either do prenatal, gynecology, primary care. But generally speaking, ambulatory care means that someone is going to be in the clinic providing care for individuals in that setting. Then there's inpatient care. Sometimes this word was new to me, which was hospitalist. And that kind of means that you are providing care in the hospital setting. So hospitalist generally means someone who is on call providing care while someone is in the hospital, but they don't always have a outpatient clinic. So it might be someone who only does only takes care of individuals while they're in the hospital, but they don't have any clinic when someone's not in the hospital. And then community-based settings, and this can be community-based can be sometimes individuals have home birth, as well as some individuals also can work in birth centers, and sometimes there's a hybrid. So sometimes individuals have a home birth practice, but they do have a clinic where individuals will come in to do screenings or have like a meeting place as well. And like I said, and then there's some practice settings where they have a birth center, they have like a clinic within their birth center, but they also provide services in people's homes. So they also might do birth center births as well as home birth. So that's just like the terminology when it comes to describing the different types of practice settings. And then we can go on to the next slide. And so I kind of try to break it down, a little bit of information about the different types of settings. Just like I had just gone over, for community birth settings. Sometimes individuals who work in community birth, they might have a strict home birth practice, meaning they don't have a office location. Some individuals who have in community birth might have a home birth practice, but they also have a clinic where individuals can come in. And then there's freestanding birth centers. So it could be, there's also individuals can practice at a birth center, meaning, and freestanding means that it is not connected to a hospital. So it might be they're in different birth centers have different things that they offer, but sometimes generally a birth center might have a room or two that they use as a clinic space. Then they have rooms where individuals can birth in, and a lot of community birth settings sometimes can do a combination of things. Like I mentioned, there's some individuals who have a birth center, but they also provide home birth services, or some individuals who provide home birth services might also have a private clinic that individuals can come to. For inpatient and hospitalist settings, there are different types of hospital settings where people can be part of. There are teaching hospitals, meaning meaning, and this is a lot of where most students are getting their experience from. It's where they're in a hospital where there are students, there are residents, there might be different attendings as well. So there are a lot of players during someone's care at a teaching hospital. There are also some labor and delivery units with and without a hospitalist. And that means that sometimes there are some maternity, or there are some labor and delivery units where there is no one whenever someone comes in for a labor evaluation, whether their water broke or they have any concerns. There are some hospitals where clients will go to the hospital, but there's not an on-staff there might not be an on-staff doctor or provider there at that time frame. So they will, that's a labor and delivery unit without a hospitalist, meaning, like I mentioned, sometimes individuals might go to the hospital, they might get evaluated first by one of the nurses there, and then the nurse might call whoever the doctor is on call and say, hey, I have so-and-so, they are 39 weeks, they are here with contractions, their water broke, or what, give a little bit of report, and then at that point in time, the whoever is on call will then make the decision of whether someone's going to be admitted or not. And this is something that I didn't know about. I had always practiced in hospitals where they always have a provider there on call, but there are in different locations, there might be hospitals, especially smaller community hospitals, where there isn't a provider there 24/7 on the floor. They have to be called in whenever, like I said, someone needs an evaluation that requires a provider at that point. And there are and I mentioned on there the different delivery providers. So there are practices that have midwives as providers there, OBGYN. Sometimes there is family practice, as well as private practice. So there's different types of providers that might all be at play in the hospital setting. And then for ambulatory clinics, we have different types of clinics. We'll have federated qualified health centers. We have community clinics, and I also put in private practice. And private practice generally is a practice that provides as well, will have a clinic and is providing different types of care. But the difference between a private practice and a community clinic is that the private practice might be run by a specific MD or a specific provider, and they're the ones who will then make the decision for what kind of policies they will use, what kind of testing they will that will be run. And so sometimes there's a little bit more leeway in private practice just because they are not part of a big healthcare organization that will then say, this is how these are the tests that need to be run. These are the policies that we need to make. Generally, in private practice, whoever is running that private practice, whether it is an MD, and there are some private practice midwives as well, and other physicians, that they are the ones who kind of structure how they want their clinic to be run, what policies they want, what types of insurance they're going to cover and take. Awesome. And then for community settings, so this is kind of where I like to mention some of the advantages and disadvantages of working in community settings. So for community settings, a big advantage is that you're a lot of the times you're focused more on holistic care. You have more time to, you have longer appointments, so you'll be able to kind of chat with individuals about their nutrition, exercise, have more discussion about what are the tests, the benefits and risks of certain testing. You'll have more time to kind of go over what are the a little bit of more time to go over, like, what are the actual results and what do they mean? So it can be a big difference between working in other settings where you have limited appointment time, from like 10 minutes to 15 minutes. And a lot of community birth settings, some individuals have like 30-minute appointments, an hour appointment. And so you have, like I said, more time to kind of talk to individuals about all their options. You also have continuity of care. So a lot of the times you'll be able to see someone, you're seeing someone throughout their entire pregnancy. You'll see them for postpartum. And a lot of the times there is generally very few providers. So it's usually you might be the only one who sees the person for all of their care, versus sometimes in other settings, we have multiple providers. A patient might see multiple providers throughout their care, just because of the way there just might not be enough appointments to see individuals. And you also have a little bit more independence on the type of policies that you kind of want to create for your clients, and go from there. And so some of the disadvantages that come from working in community birth settings is that there is a big limitation to how many individuals have access to these services. A lot of the time, some birth centers or some home birth midwives might accept insurance, but a lot of them might not be able to, just because of the requirements that insurances require in order to reimburse for services. So again, there might be limited amount of individuals who have access to be able to birth at home or be able to have a birth center birth, just because their insurance, they might want to have that experience and want to have that care, but it's not covered by insurance and they're not able to be able to afford to pay out of pocket. Another sometimes disadvantage can come from an on-call schedule. So sometimes in community birth settings, you might have maybe 1 to 3 midwives, depending on how big the practice is. Generally, in some community settings, the practice is a lot smaller. So you might be on call for a longer period of time, in order to make sure that there's someone always available for whoever is whoever's in labor. And every practice has their own way of scheduling individuals, and on-call schedules can vary. But if, let's say, someone has their own home birth practice and they're the only midwife taking care of individuals, then they are on call for an extended period of time in order to be able to take care of their clients. And they might partner with other practices or other midwives to say, like, hey, if I'm not available, this Wednesday because I have this event going on, can you be my backup in order to make sure that during that day there is someone available if someone goes into labor. But that can be a little bit of the tricky spot of when people have their own practices of like who is going to be able to take care of individuals when they are not available. And then again, another thing for community diverse settings is that some individuals, it might be their own business. And so trying to make sure they get reimbursed and trying to make sure, like, when it comes to vacation time and all of that, having to plan that out months ahead of time of, okay, I might not be able to take clients from this month to this month because I'm going to go on vacation and there's not going to be backup provider during that time frame. So that's a little bit about community birth settings. Does anyone have any questions on that? Okay. Awesome. And then for ambulatory care settings, so this is more of, especially for a lot of the individuals right now who are going through the clinicals, this is where you're going into the clinic from a specific time frame. Like, I'm going to go in to clinic from 9 to 5, and I'm going to have 6 or anywhere 6 patients in the morning or what have you. And so ambulatory care is providing care for individuals in a clinic setting. So the benefits of working in an ambulatory care setting is you have a more predictable schedule. Most of the time individuals have, it's either 9 to 5, 8 to 4, or they'll have a specific time frame of when you have to be in what time frame you're going to be in clinic. There are a variety of different types of clinics and specialties. So some individuals, they say, I only want to provide prenatal care. Other individuals might say, I want to provide prenatal care and gynecology care. And so different clinic settings, you can kind of mix and match of what you would like to be able to provide and what the scope of your practice is that you want. So sometimes individuals might say, like, I only want to focus on prenatal care, or I only want to focus on Mondays is going to be my prenatal care clinic, and then on Wednesdays is where I'm going to do procedures. So that's when I'm going to put IUDs in, Nexplanons, all of that. So there's flexibility in that regards. Downsides for only working in ambulatory care sometimes can be, there is a lot of administrative work that sometimes we don't think about, especially as when you are going through your rounds through different clinics. As students, you're seeing patients and you're writing your notes. But a lot of the times we don't, and sometimes you might order some labs, but the downsides that we sometimes don't think about as students, that I do like to point out when you then work by yourself, is that there's administrative time where you have to have time to follow up with lab results for people. You have to put in consults for if you get something that's abnormal and is out of your scope and you need someone to be evaluated by another provider. You do spend a lot of time also following up for all of these things. Another thing is, I put it in capital letters, is coding, trying to figure out, okay, if I do, this procedure, is it going to be, in order for it to be reimbursed, I have to make sure that I have the correct codes for everything. So learning how to, while you're seeing individuals, also learning how to code for different procedures, code for the type of care that you're providing in order for the clinic to get reimbursed. I think that's on that piece. And then for inpatient care, this is where we get into there's so many different types of practices out there. Some individuals work as midwives who only do inpatient or hospitalist care, meaning they only do deliveries, or they only do postpartum rounds, but they don't have clinics, so they don't ever do clinics. So that is another type of practice setting that an individual can be part of. And there's different types of inpatient services. So there is teaching hospitals, and care is usually provided. So you have multiple providers. So you have students, residents, and attendings. Generally speaking, teaching hospitals, there is always a provider there in order to supervise all the different types of learners. And this is generally when people are going through their different rotations, most people are learning from teaching hospitals. And so this is generally the type of care that we are exposed to while we're going through midwifery school. There is also different types of practices when it comes to maternity care units. So sometimes there are some practices where all the care is provided by a specific service. So let's say, I'll give, for example, at San Francisco General Hospital, you have the midwifery service, and then you have the OBGYN service. So when clients come in when they're in labor or to be evaluated, they always ask them, who's your prenatal care provider? Do you see an OB or do you see a midwife? And then depending on who they see for their prenatal care, that's the individual who will then do their who will evaluate them in the hospital. There are other practices like some Kaisers where any individual who is low risk and full term will be evaluated and seen by the midwife or family practice. And then if a certain individual becomes like higher risk or they have more complications, then they are transferred over to the OBGYN service. So some hospitals, like I said, have multiple services, whereas, and it kind of depends on, do clients are seen by like where does it split, as in when do they see what provider? And so, like I mentioned, that some hospitals do not have multiple providers. They only have one type of provider providing care. And then we have one additional one that I added was private practice. There are some places where a provider might have privileges to deliver at a hospital. So they are not paid by the hospital. They only care for clients who are seen in their office. So let's say an example would be, I don't know, like we'll say San Francisco Clinic, and then there is a specific provider there. And whenever their individuals are going to go into labor or they're going to need to have a hospital evaluation, they show up at a particular hospital and they'll say, my midwife Diana sent me to this hospital. I'm in labor. And so I, as the provider, will go and be with them for their labor evaluation or whatever evaluation they're there for, and send them home or admit them. So private practice, you're not taking care of every individual who comes to the hospital. You're taking care of clients that you've been following. So that's just a little bit of a difference. And then these are just some questions when you're looking at practice settings of like, where am I going when you're looking to apply to different practice settings. So how many practice settings are you expected to be at? So like I mentioned, some jobs are only for in the hospital. Some jobs are you do hospital and clinic. Other jobs might be that you're only in the clinic. You do not have any hospital privileges. So how many practice settings are you expected to be at? How many and how much time is spent? So do you do like multiple clinic days and then a few days where you're in the hospital, or do you do all hospital and only like one clinic day? So if there is more than one practice setting, how much time is spent at each one? And then what type of providers are at each setting? Is the practice have a combination of individuals? Is there family practice? Is there OBGYNs? Is there a physical therapist? Like, who's in that practice with you? And so because sometimes there are practices that are only like, there is a combination of like OBs, family practice, and midwives. Some practices might be only a full midwife practice. So there are different, that's another thing to kind of be asking of like, okay, at this setting, like who is there? And again, how many providers and which type of providers are there? So that's kind of most of what I had to go through, of like a broad overview of like the different types of settings that individuals, you know, as midwives, we can be part of. And it's hard because a lot of the times when we're going through school, we are only exposed to the, you know, to the practice settings that where they're accepting learners, and a lot of the times it's a teaching hospital, or we're going to clinics. But when we go out there and we're trying to apply for our first job, we're like, oh wait, what does it, like, if I take this job, like, where am I expected to be? And so it's nice to kind of like learn a little bit of like what the wording is when you're looking at those job postings.